Good morning, my name's Anne Marie and I'm the esthetician here at Contour Dermatology, one of the estheticians here at Contour Dermatology. And what Doctor wanted us to talk about today was the difference between what is offered as far as chemical peels in a medical setting compared to a spa setting. I have worked all walks of life, as far as spas to not so nice spas to the elite spas, and then my final journey here at Contour. The typical spa is going to have more of the light peel where there's no downtime. We have the Vivite as ours, and then we have SkinMedica's Illuminize. You're not going to see anything magical or dramatic. It's nice, and these can be nice too. But if you just want nice, that's great. That's something we'd offer with a facial, usually never alone. We get a little stronger with a product that Dr. Joshin himself loves, and he just finished telling us that he uses on a daily basis, and it is Glytone. It is a stronger glycolic. Again, there's no downtime, but you will be red after this treatment. And then we get a little stronger, and we have SkinMedica's Vitalize. Now this is SkinMedica's personal take on Jessner's formula. It is still a little weaker than Jessner's formula. Then we get to what we typically do at a derm office. We have Jessner's formula. This is a 14% solution of lactic acid, salicylic acid, and we complete the peel with a final wipe of retinoic acid. We also have salicylic 20%, which is for acne. This peel, you will often hear it promoted at spas and salons. The difference between ours is it is Jessner's solution. A lot of times they will have Jessner's formula, and the difference is Jessner's solution is a specific percentage per acid. Jessner's formula is more of a take of, we do it a little weaker, we don't do it as strong, and it's not as effective. Finally, we get to our stronger peels. These are not offered in any spa setting. They are only offered in doctor's offices. They are only sold to doctor's offices. So this is the VI peel. This is one of my favorite. It is salicylic acid, lactic acid, retinoic acid, and ascorbic acid. This peel can only be done 5 times a year. That's how strong it is. And you will shed sheets of skin. It is a beautiful peel. And then finally, this is the best peel for melasma. It is really, as far as peels go, the only thing that we have found that is effective on melasma. This peel is an entire kit. It targets melasma specifically, and this is also not sold in a regular spa setting. So today we have Miss Beautiful Paige, who has, I almost forgot her name. Not unusual for me here. Names are just labels our mothers gave us. So we're gonna go with Miss Beautiful here. She explained to me before we started that her concerns with her skin are she gets a little dry around the nose and then something about blackheads here. My concern with her skin is she has a little bit of bumping and pimpling here, some freckles. And when we're young, we think our freckles are cute. Just wait until you're about 40. Nobody thinks your freckles are cute anymore. They become blobs on your face. So we're gonna do a Jessner's on her. The reason I like the Jessner's for her is, one, she's never had a peel before. I get to control the acid with the number of layers that I use. So first we're gonna cleanse her skin. We either use alcohol or acetone. I'm using alcohol today because this peel can be quite sensational. I like that word. Okay. And her face is really clean. Good job. Thanks. So this peel is applied in layers. And we gauge her response by the frosting and the redness that her skin will demonstrate. How is that, Bernie?
A little bit. She doesn't care.
She doesn't care. So then we let the first layer dry. It will turn a white frosty color. She will turn pink, and at that point is when we stop. That's one of the reasons I like this peel, is it's very easily controlled. It usually doesn't shoot out crazy fire. There's not very many contraindications. The salicylic isn't too high, so I get to address her little bit of acne. The lactic acid and the retinoic acid we finished with will help with this freckling. The salicylic acid will address her concern for blackheads without over-drying the area around her nostrils. You can see she's pretty resilient. You okay?
It tingles.
It tingles.
Tingles.
I like that word. This one compared to the salicylic acid burns. You cannot do a salicylic without a fan because it is quite sensational and it seems to get more intense as the peel goes on. So we're gonna stop with 2 layers for her because she is frosting for me already. Sorry, I'm cutting. She will peel, today is Thursday, so she will peel Saturday. And it will start around her nose and her mouth. So she'll look really hot for a date. And then it will slowly migrate up on the face. Sometimes we do this peel, do you use Retin-A? So she doesn't use Retin-A, so she'll probably peel very quickly. She'll probably lose a lot of skin. It'll be great. Sometimes when we've had an old pro that's had peels several times, we're a little more aggressive. And sometimes they'll even peel up to 2 times. And that's great. We get rid of that dead skin. When we get rid of dead skin, the body hurries up and produces new cells. We speed up that cell rejuvenation factor. As we get older, our cells slow down just like we do. So we like to speed them up like little babies and try to get them back to that 21-day mark. And that's what chemical peels are really excellent at doing. So finally, her peel is done. And she's done with the agony and the pain, so I will give her a nice soothing coat of retinoic acid.
That was a trick.
It does feel better though. She's going to look yellow, a little jaundiced for about 15 minutes. No big deal. By the time, if you came in and had the procedure done and had to go back to work, by the time you arrived at work, the yellow would be absorbed and gone. You feel pretty good now? Yeah? So we instruct her, do not wash your face for a minimum of 4 hours. If you do, it will probably be quite hot again. I prefer that my patients don't wash their face until right before they go to bed to give it a better result. The retinoic acid will continue to work for several hours and you'll have an amazing result. All right, that's it.